The next problem is a plantar plate injury. So plantar plate is a soft tissue that located underneath of the metatarsophalangeal joint. It attached at the metatarsal head area and go along to the proximal phalanx. When the plantar plate injury, so the metatarsal head can drop down into the ground, and then the proximal phalanx can be elevated in the upward positions. Patients usually presented in the clinic. They usually complain about pain underneath of the metatarsal head or underneath of the bottom of the foot. And if they have long standing, so the toe can be elevated and separation in the V sign here. This is a sign of the plantar plate and collateral ligament injury. If they have this problem and doesn't do anything, so the toes, the IP joint will be friction, and they end up with a hammertoe deformity. So you can see here on the left hand side, we will do the drawer test. You can see here at the tip of the mouth, you can see the bone that can go up more, upward displacement because of the plantar plate injury. And on the right hand side, so you can see the plantar plate is moving up top. You can see here, see it's moving up top because of the plantar plate injury. The proximal phalanx can go up easily. So for the treatment, we can start with the conservative management. We have two techniques like bow tie here, and also the three finger techniques that wrap around between the big toe and the third toe and try to depress the second toe down. So they can be prevent the cross toe deformity. But the problem is inconvenient, and you need to be taping until you die. So some of the patient doesn't like this technique. So another technique will be a plantar plate repair. You can use a dorsal approach, and then we can use a micro-Russell, or we can use a special instrument from a hat-trick tray or scorpions to repair the plantar plate and do the whole attachment at the proximal phalanx. The next problem is a hammertoe or claw-toe deformity. So here was the term that need to be clarified. So hammertoe deformity is have a hyper extension of the metatarsophalangeal joint and flexion of the IP joint. For the mallet toes, what's going to be a hyperflexion of the DIP joint. For the claw toes, hyper extension of the MTP joint, flexion of the proximal interphalangeal joint, and extension of the distal interphalangeal joint. For treatment, is similar to the plantar plate injury. You can use a taping. Try to conservative management, and if it works, you can try and you can continue to do this. But if it doesn't work, so you may need to do the surgical fixation. We will check the flexible or rigid of the hammertoe. If flexible hammertoe, we can do a flexor to extend the tendon transfer or girdlestone procedure. But if it's fixed deformity, you may need to be resection the joint and do the IP joint fusion. This will be the permanent take care of the hammertoe deformity.